Let's take a look at the
few years.
I've got a lymphoma, which is cancer of the lymphatic system, specifically around my stomach area, and I also have AIDS.
Are you afraid?
Yes and no. I'm not scared, but I'm not naive about the possibility of outcomes.
AIDS, Acquired Immune Deficiency Syndrome, looms as the greatest health crisis to face this country in a generation. Tonight's Four Corners is devoted entirely to AIDS. Thanks for joining us. Despite an almost obsessive interest in the subject by the Australian media over the past 12 months or so, AIDS and AIDS-related diseases remain mysterious and misunderstood in the public mind. In this program, we've tried to get behind the myths and irrational fears to tell the real story, which it must be said is frightening enough. It's a story which concerns us all, not just the gay community. But it's not possible to discuss AIDS meaningfully without including material which some people could find offensive and possibly unsuitable viewing for their children. Our profile of AIDS was produced by George Pugh.
By mid-1987, this country will experience as many deaths from AIDS as we did in the Vietnam War.
If we use the minimum figures available from America, we would expect that probably within the next 3 to 4 years we would get a minimum of around 2,000 cases. And if we use the maximum US figure, we could see up to 10 to 12,000 new cases of AIDS within the next 3 to 4 years.
It's our #1 health problem, and it is going to be an expensive one.
Tell me why! Tell me why!
Cholera, typhoid, smallpox. Australia's splendid isolation resists the old maladies of the East, but we're vulnerable to trendy Western epidemics. You can't inoculate against free thinking. You can't quarantine a lifestyle. Australia has been infected by the permissive 80s. Sydney's Oxford Street is the Sunset Strip of Australia's gay community, a social magnet for a minority whose sexual conduct is still outlawed in 3 states. One night of the year, they let it all hang out. This February, Sydney's homosexuals had special cause to celebrate. Their private conduct was decriminalised in New South Wales just 9 months ago. They claim that's meant liberation for more than 100,000 homosexual men and women in Sydney alone. Many gays still avoid advertising their sexual preference to the general community. The annual Gay Mardi Gras is their release, a public coming out. It's a display of solidarity by people who've often felt isolated. And for straight society, it's an entertainment highlight of the year. But this year brought a new dimension to the Mardi Gras. Among the gaudy floats was a jolting reminder that beneath the carnival atmosphere, there's a growing fear. AIDS has arrived. The gays' newfound freedom is now threatened by a medical crisis with ominous possibilities. The party may be over. In the summer months of 1979, a handful of young men in New York and California died from unusual infections that normally don't trouble the young and healthy. Doctors were baffled by the seemingly random pattern. The cases were widely separated, yet disturbingly similar. There was no obvious connection, except that all the victims were homosexual.
Here we had a disease which we had never seen before, which at that time we didn't even know how it was spread. We didn't have the agent, the causative agent, and it was universally fatal. You put those together, that is a fairly anxiety-producing situation.
Gradually, a pattern has emerged. AIDS stems from a virus which appears to have been endemic in a number of African states for generations. It's thought that over time, these people developed a measure of tribal immunity to the deadly virus. But of course, visitors to Africa have not built up protective antibodies in their blood. And the disease probably spread to the rest of the world in the 70s via migrant workers from Haiti returning to the Caribbean. There, they mingled with equally susceptible Western tourists, often gay, whose travels rapidly fanned the AIDS virus through North America and beyond. It's known to have killed at least 4,000 Americans already. Apart from the many known sufferers, thousands more are as yet unaware they've even contracted the virus, which has an incubation period of several years. As the name suggests, acquired immune deficiency syndrome lowers the body's natural defences, leaving it vulnerable to attack by certain cancers and opportunistic infections. But mere exposure to the virus is not an automatic death sentence.
The AIDS-related virus infection is certainly not a death sentence. Those that catch the AIDS-related virus and go on to get AIDS, then sure, AIDS is a death sentence, but catching the virus itself is not.
Some people will develop no illness at all, and we're quite sure that a reasonable proportion of people will remain otherwise healthy for some period of time. However, a number will develop what we call AIDS-related conditions or lymphadenopathy syndrome. Now, that is a clinical situation in which they will get enlargement of the lymph glands, which are usually glands in the neck or in the armpits, particularly sites where the lymph glands will enlarge, together with a number of other symptoms such as weight loss and diarrhea and fevers. Now, in a proportion of those people with that AIDS-related condition, there will be the presence of a failure of the body's immunity.
The AIDS-related virus behaves in the same pattern as every other virus and every other disease known to mankind, in that most people who catch the virus do not get sick, are totally unaware they have it, they're carriers for a short time, and then they get over it. And that is the big group. The middle group is where they get a bit sick and recover, and the third and smallest group is when they die. Now, in the AIDS-related virus, AIDS is only that small group of the people that catch the virus that eventually die.
AIDS started out in Africa very much a heterosexual disease. Unhappily, some of the more permissive practices of Western culture have proved a far more fertile breeding ground. The virus is contracted by the absorption of bodily fluids, notably blood or semen, from someone already infected. It won't be transmitted by normal external contact unless the skin is broken. So those most at risk are intravenous drug users who share infected needles and sexually mobile people who absorb infected semen. A woman can be infected just as easily as a homosexual man. But once infected, the man can infect others with his own semen. It's much harder for a woman to pass on the virus.
Now, the penis has a very tough skin, like normal skin. The vagina does not, and so the abrasions occur in the vagina very easily, so the woman can catch it from a bisexual man, but once she's caught it, it's very difficult for her to give it to another man because the penis skin is tough.
San Francisco, the gay capital of the world. Here, they have no doubt that AIDS is essentially a homosexual phenomenon. Someone dies from AIDS in this city literally every day now, and 90% of the victims are gay. San Francisco has a population of around 3 million, about the same as Sydney. The two cities have much in common, including a certain bohemian streak. San Francisco is a mecca for the fringe groups of society, a haven of tolerance, a crucible of emerging social trends. Through the 60s and 70s, San Francisco became a refuge for alternative lifestyles, especially the gay subculture. Gays of both sexes flocked to its liberated embrace from every state in the Union. Some parts of town, like the inner city area of Castro, became virtual gay ghettos, where homosexuals can live confident and secure. Gay Lib had come to stay, and the gay vote was a force to be reckoned with down at City Hall.
They probably make up about 1/5 of the population. They are generally have a good income. They generally vote, and therefore I think present, if they were to vote as a bloc, and I don't know many groups of any people that ever vote as a bloc, if they were to vote as a bloc, would be a very strong force and are a factor in city politics. Make no mistake about it. There is no question about that.
Enter the 80s, and AIDS exploded onto the scene. Across America, the number of cases diagnosed went from just 8 in 1979 to 8,000 this year. Cities like San Francisco were faced with a sudden and unexpected health crisis. When the AIDS epidemic hit, Dr. Mervyn Silverman was Director of Public Health for San Francisco. He now advises both the city and federal governments on ways of containing the deadly virus.
In the gay community, probably almost everyone has been exposed. Now, having said that, we can't go on and then say what that means with any real sense of surety. In other words, you have people who may have been exposed, carry the virus, and get over it, and are immune from it. You may have people who are carrying the virus, may not come down with AIDS, but could certainly transmit it, or could come down with AIDS themselves. Those answers we don't have right now. Worst case would be a devastating situation. Best case is probably 10 to 20% may come down with AIDS. So it's still, best case is a very bad situation.
Right now we are projecting, and these are conservative projections, that by the end of 1987, San Francisco will have at least 7,000 diagnosed cases of AIDS. The state of California will have at least 17,000 diagnosed cases of AIDS.
The crisis in San Francisco has been watched with growing concern by other Western countries, in the knowledge that the lengthy incubation period for AIDS might mean they're already primed to follow the same alarming pattern. Early this year, Australia's Federal Health Minister, Neil Blewett, flew into San Francisco to see things for himself. He's clearly disturbed by the potential of AIDS.
We've got to stress, above all else, that we've got a serious health problem here, a health problem which, on all the evidence from African countries where this disease originated, will spread out across particular sexual barriers unless we can effectively contain it. From your experience and some of the things not to do.
It was the search for effective containment that took Dr. Blewett to San Francisco, and a crowded schedule of expert briefings. The minister was a good listener.
Here in San Francisco, we've developed such a good system to provide support to people with AIDS outside the hospital, as Gary was telling you about the other day.
Again, you have some gay physicians groups starting down there in Australia. You need to build some bridges with them in your public health sector as well.
Plus a volunteer program, which I think is very important. I guess what a lot of this comes around to is working very, very closely with the affected communities and getting their support.
I think that's been a major effort in San Francisco. Every major body that the government here has set up in the San Francisco area has had gays on the institution. They're on the advisory council. A group of gay doctors are represented on the medical task force, and various gay organizations have been involved in the whole development of the prevention and education campaign. I think that in many ways San Francisco in these respects does provide a model which I know is being copied in other parts of the United States, and also European governments are looking at it.
Part of the San Francisco model is the AIDS hotline.
Yes, may I help you? Okay, the symptoms of AIDS are...
It's one of a wide range of professional and volunteer services offered by the San Francisco AIDS Foundation.
Persistent diarrhea, persistent fatigue, drenching night sweats, unexplained swollen glands.
Many of the volunteer staff are themselves suffering from an AIDS-related condition. With no cure, no vaccine on the horizon, the AIDS Foundation is channeling its mix of public funds and private donations into a campaign aimed at modifying homosexual behaviour. Jim Ferrells is the executive director.
Education is a key to prevention, that people have to understand how the disease is transmitted and not just understand it in a theoretic sense, that they have to act on their understanding and change their mode of sexual behavior.
The catch cry is safe sex. The campaign is explicit, frank, no nonsense. The aim is to break the so-called semen chain.
When we talk about risky sexual practices, what we're really talking about is rectal intercourse, oral intercourse, mutual masturbation, body rubbing. A lot of other sexual practices are perfectly safe. And use of a condom is also safe. It prevents transmission of venereal diseases. So that there are ways and means which we term safe sex that you can continue to enjoy an enriched sexual expression.
And the message may be getting through. At least the signs are hopeful, according to the AIDS Foundation's Holly Smith.
We've just recently conducted a major research study of the gay male and bisexual male populations here in San Francisco, and that survey says that 2/3 of that at-risk community is making conscious change to move away from unsafe sexual behaviors.
What's the proof? What's the evidence of that?
Well, the proof is something that we won't see for another 2 to 5 years, and that's because the incubation period is so long. However, we are able to take a look at the rectal gonorrhea rates, which have an incubation period of 3 days, and see that over the course of the last year, actually the last 2 years, we've seen a significant drop in the diagnosed cases of rectal gonorrhea in San Francisco.
So you feel that this safe sex campaign is very likely to influence the AIDS situation to some degree?
We hope so.
You better read all around that 3.4 more. Has to do the right man through.
The open acceptance of homosexuality in neighbourhoods like Castro is undoubtedly a factor in the spread of AIDS. But that same tolerance also makes it easier to come to grips with the problem. Although the AIDS epidemic is as serious in San Francisco as anywhere in the world, there's probably less hysteria here. The subject hasn't been driven underground to become shrouded in ignorance and mythology. These citizens are being armed with knowledge for the fight against acquired immune deficiency syndrome. But even in this liberal environment, the AIDS phobias can flourish.
Certainly with AIDS, and in San Francisco, we saw points of bus drivers wanting to wear gloves and face masks if you were a policeman out in the street, sort of thing. They're ludicrous. We know that disease is not transmitted that way. That sort of casual contact or airborne contact is not the way this illness is transmitted. So that sort of hysteria is really unwarranted.
Yeah, there was a great concern that you could catch AIDS from mosquitoes. Now, I can understand that because mosquitoes bite and there's blood, I suppose. But no, you don't get AIDS from mosquitoes. And then there were, do you get it from teacups and knives and forks? And then someone rang and wanted to know if you could get it from the communion cup.
There is absolutely no justification whatever, and I can categorically say that there is no risk other than needle pricks and sex whereby you can catch this virus. If anybody in the world could catch it non-sexually, it would have to be me, because I handle literally thousands of these contagious gay boys, and I have not caught the virus from any of them.
There's probably been less hysteria oddly enough, in the places where AIDS is really most serious, such as New York and San Francisco, and most hysteria in places such as Texas, where AIDS has been invoked by a whole series of right-wing groups in very, very nasty and malicious ways. Now, I suppose there's some parallel to Australia. There's certainly, from what I know, much more hysteria in Queensland, and quite extraordinary statements from Queensland state authorities of a sort we don't hear from their equivalents, even in the Reagan administration in the United States.
To some AIDS sufferers, the most distressing claim, to others the most absurd, is that the Almighty himself is punishing them. Divine retribution for their wicked worldly ways.
Oh, that's the theology of the common cold. If AIDS was the wrath of God, then we would have to say that patriotic Americans were being punished by God because they got Legionnaire's disease. We'd have to say little children in 1948 and 49 were punished by God because they got polio. That's a theology by a group of people who have a mean, small, and ugly God. And I always say to them, I wish you'd try my God. My God's real big, and my God smiles a lot.
It can't be easy to retain faith in a smiling God when you're gay and fighting in the front line of the war against AIDS.
I hope we don't lose sight of why we're here. We're here because our brothers are dying. 4 years ago, a man told me that I would know someone within a year who would have AIDS. I heard him, but it didn't really make any sense to me. 4 years later, John and Fred and Kevin, Colin and Bobby are dead.
The relentless inroads of AIDS has shaken Sydney gays to the core. If Australia reflects the San Francisco experience, probably 88% of cases will be homosexual men. The rest will be mostly mainline drug users and haemophiliacs in contact with tainted blood. The gay community is funding extensive self-help programs, but the rot's set in.
The number of people who are being diagnosed with AIDS is doubling every 3 months. There are presently 40 people, perhaps, and so in 3 months that will be 80, and in 3 months more that will be 160, and in a year's time that's over 300 people, and in 18 months' time that's 1,000 or more people. And then we look at how many friends, what's their network like, and if we multiplied that by maybe 5 would not be unreasonable. So there are 5,000 other people who must be given help.
This is Sydney's 2UE, keeping you in touch. The First Lady of Radio, Ita Buttrose.
Good afternoon, Mary. No, you don't have to be worried about giving blood at all.
As the AIDS epidemic gathers momentum, the Australian government has conscripted media personality Ita Buttrose, recently voted our most admired woman, to head a national advisory committee.
I don't want to cause panic, that's the last thing I want to do. But I think we have to realise that we are facing a serious health problem, and the entire community and every government, including the Queensland government, has to work together.
Ita's committee has the backing of nearly $5 million of federal money.
That's an emergency grant, and that lasts until the end of this financial year. And 2.7 million of that has gone to the blood screening processes that are going to be set up in the blood banks throughout Australia. And we've spent $1 million already on advertising. We did a campaign in print that addressed itself to how AIDS was transmitted and some of the myths, like do you get it from mosquitoes and can you catch it in swimming pools and so on, because there's a lot of fear in the community, and it's very important that these fears be put to rest.
AIDS is a fact in our health system and a major problem to our health system, and all the evidence that I've seen is that we will cope with it best by governments having a cooperative relationship in this matter with the gay community. That doesn't mean doing everything that the gays want governments to do. Governments have to make their own decisions, but we have to retain the confidence and the cooperation of those communities. That may be distasteful to some state governments, but the evidence overseas is that that kind of cooperation is going to be necessary if we're to effectively deal with this very difficult health problem.
In San Francisco, people recognise that if most cases so far are among people in the gay community, then you have to get that community represented and involved. And what I think is impressive in San Francisco is the way in which everybody from Mayor Feinstein down finds no problem with this. I mean, the attitude that you got from the Queensland state government, they wouldn't go to a conference where there were gay representatives, would quite honestly be laughed at in San Francisco. Nobody, not even the most conservative member of the Board of Supervisors, would ever dream of saying something like that.
There's no place in this room for homophobia. This is the weekly AIDS strategy meeting at Sydney's St Vincent's Hospital, where representatives of various gay groups compare notes and talk tactics with key medical personnel. Some 40 AIDS patients are already in treatment at the hospital, and there'll be many more.
We're dealing with a disease which is behaving as an epidemic. And although the numbers in terms of an epidemic are small, it is a disease in which the numbers of reported cases are increasing at an alarming rate, and in the absence of any cure or disease control, the numbers should continue to increase at the same rate.
Unless we gear up and put effort into producing people, volunteers and services, we're not going to be able to cope with the epidemic when it really hits.
The St Vincent's team is conducting a long-term survey of more than 1,000 Sydney men who feel they are at risk of contracting AIDS. Gary Cox is one of them.
How many different sexual partners have you had in the past 6 months? For how many of your sexual partners in the last 6 months do you still have a contact address or phone number?
Gay volunteers like Gary Cox have come out for the research project knowing it will do little for them as individuals. They could just as easily be screened privately by their own doctors. But the information being gathered is vital for the gay community as a whole, indeed for all of us.
That knows who belongs to a number. Okay?
That's fine.
All right, well, let's start with the blood. Right, let's have your arm. Just a little needle prick, doesn't hurt hardly at all. Now you'll notice that I'm not taking any precautions, I'm not frightened of catching anything from you. I don't think it can be contracted socially, only sexually or contaminated the needles, okay?
I see.
Right, now look the other way.
First, he's checked to see if his immune system is healthy. And if he has been exposed to the AIDS virus, his blood should contain antibodies.
Yeah. What antibody positive to the AIDS-related virus means, and only means, is that at some stage in their life, that person has contracted the AIDS-related virus. Now, that's as far as the test goes, and then it's up to us as doctors, which is very difficult for us, to determine whether they're likely to go on and get worse in the future, or whether they're likely to remain healthy, and the only way we can do that is to just keep observing them through blood tests and just watching their immune system. They have a high chance of survival and they have a slim chance of death.
If the tests show that the immune system has been damaged by the virus, the doctor can do little except urge the patient to change his lifestyle, to get plenty of good food, rest and exercise, and to avoid the use of recreational drugs so prevalent in the gay scene. Amyl nitrate, amphetamines, marijuana, even alcohol, all act as immunosuppressants. Almost half of those surveyed were found to have antibodies in their blood. Gary Cox has just been given the all clear, for now. He knows that his lifestyle will continue to place him at risk. He's one of the worried well.
Yes, I'm afraid, yeah. Especially when, I hear of more friends and acquaintances who either are developing LNS or who actually have been diagnosed with AIDS. People who I'd always assume were very fit and healthy. And also seeing people in that state is really very frightening. Very frightening indeed.
AIDS strikes at your very sexual personality. You can draw a very close parallel indeed with the woman who must have an operation to remove her breast. This immediately strikes at her very self-concept. Will my spouse still love me? Am I still a complete woman? A man who gets AIDS is no longer the object of attraction. He is now sick. He's almost a lapsed member of that society. That's a particular need.
I think there's an element of the community who seem to feel that homosexuals don't have feelings, that they're not human beings like the rest of us. When a homosexual loses a partner, he grieves. It's like, for me, it would be like losing my child. And it's painful, and like all of us, they need counselling. And the AIDS sufferer himself needs a lot of counselling. Anyone who's had a terminal illness, anyone who's been told they've had cancer, for example, needs help to get through life and to face death.
Certainly the people we're about to meet need help to get through life and, in some cases, to face death. 3 of them have full-blown AIDS and associated cancers, normally a fatal combination. Then there's Gary Cox, the young man we just saw receiving a clean bill of health, but who's fretting about the future and the friends he's already lost to AIDS. But first, Bruce, a Sydney social worker with an advanced case of an AIDS-related condition known as LNS.
Last year I received the diagnosis of lymphadenopathy syndrome, which means that I had an impaired immune system. I think I have to face it. The chances of any sort of real recovery are nil. It's not something one likes to think about because the illness as it progresses is particularly nasty. My resistance to cancers is probably very low, and, you know, I keep looking to see if I've got Kaposi starting. That's a cancer of the veins. In some ways, the easiest way to die would be getting a pneumonia, which would take you off fairly quickly, because some of the other effects of, well, viral infections which attack the nervous systems are really a bit too unpleasant to contemplate. I haven't yet had a chance to talk to some of my family, but I'm not that close to them now. But my ex-wife's been particularly helpful and supportive. My gay friends at first, or many of them, especially those who knew very little about it, were perhaps reluctant to touch me. But as education's got around that it's not sort of contagious in the flu sense, but rather something which you require very intimate contact to pass it on, people have become very much more warmer and much more able to relax and be relaxed. I mean, the people who I live with, I think, are probably, most of them are antibody negative. My lover, who been around for sort of 3 years, is still antibody negative according to the tests. And yet, you know, at some stage I must have been infectious.
You have a lover, yet do you have any regrets about how you might have contracted this disease?
Well, I don't regret loving a number of men, no. No, I don't think I'd say I regret that. I don't regret coming out gay and being open about it, and I don't regret that side of it. I just wish I wasn't around when it happened. Everybody with illness tends to be devalued, run down by our society, treated as somebody of little value. I think one of the first things that those who have any contact with it have to realize is isn't a disease to be ashamed of. I'm not ashamed of having AIDS, and I don't think anybody who has it should be. But I can get very angry about the reactions to my illness. And I find that you know, listening to the radio, the news, reading the newspapers can be very, very hard when you actually got the illness and you read what people say about, you know, people with AIDS. You know, sort of blaming us for the end of the world.
I immediately went into shock. I knew nothing of AIDS. I always thought, oh, sure, you hear about it on the streets or in an article here and there, but I was one of those people who thought, well, that's always somebody else. That doesn't pertain to me. So it was initially quite a shock. I'm healthy today, but I could have pneumocystis tomorrow and be dead in 8 hours, or one of many other opportunistic infections. I have such a great support system. None of my friends turn me away. I'm included in all activities. My lover has been very supportive. The rest of my friends have been very supportive, my family included. I've just had the best of treatment in that category all the way around.
So you have a lover?
Yes.
And how did he respond?
Well, initially he was just heartbroken. I've been fortunate enough that it hasn't, my illness hasn't really affected me physically in any way. But he immediately began to find out what there was to know about AIDS. And I'm sure he's had his pessimistic moments, but on the positive side, it's really brought us even closer together. His priorities have rearranged from top to bottom also. And we're dealing with living an everyday life on a much more realistic level. A lot of the crapola jealousies and that sort of thing have just vanished. We realized they're not important, never were important. And both of us enjoy each other and the rest of our friends and all of our activities with just a little more gusto and a little more appreciation, I think.
A lot of my fear is about losing my very close friends. Feeling, well, I may survive, but what's it going to be like if I haven't got, you know, Gordon, Martin, lots of other people that are really close to me. I got 2 letters from a friend of mine in London. The first of which said that Simon had been sent to hospital and had a diagnosis of AIDS and was currently suffering with pneumocystis. And was in a very bad way. The next letter I opened, the same day, said that he'd died. And that was really shocking news. And now it's affected his boyfriend. His boyfriend has Kaposi's sarcoma and feels very guilty about Simon, which is really unfortunate. And another friend close to them both, Pete, he has LNS at the moment. So, you know, things look very, very sad. And it really brings out a lot of fear that who's going to go next? It's almost like dominoes. Most of the time I kind of try and put it at the back of my mind, but whenever I hear another person who's been diagnosed one way or the other, or I hear more news from London about how my friends are going on, then it brings out all my death fears. And you know, I've written a will, which I don't think many people my age would have done. And I've written exactly how I want the funeral to be. And I've had dreams about my death, which have been me now, not me in 40 years or something, but me 25. And it is very frightening.
Well, the last I heard, they expected that people with KS, which is what my diagnosis is, had an expected life of 4 to 5 years after initial diagnosis. I'm coming up on my 3rd anniversary. I'd like to think that they're wrong and there's a lot of time left, but at the same time, I'm realistic that the odds aren't in my favor. My sister has been afraid. When I was first diagnosed, it took her 4 months before she came to see me. And then she got pregnant and couldn't see me at all. She had so much fear. Her husband was behind part of that, too. I know he's homophobic and has been since their whole married life. But what frustrated me was that she wasn't willing to listen to the doctors and nurses and read the information that I sent her that might have helped her deal with her fear. So she's continued to be fearful, and she's stuck 20 minutes away, and I'm here, and I haven't seen the twins, and we don't communicate very well. It's very likely that if you were a shit before your diagnosis, you're going to continue to be a shit after your diagnosis. You know, it's not this the hand of God coming down and touching your life sort of thing. It's given me an opportunity to look at my life and to look at who I am and to see what's most important to me in my life and the people that are most important to me. I've been able to sift through the bullshit, to find ways to make myself happy, to find ways to smell the roses and to look at the sunsets and really, oh, what's the word? Just, nature is so awesome. And when you allow yourself just the time to observe what wonderful things are around you, it's in a way, it's spiritual, and it could be God spiritual or life spiritual or the ego or I spiritual, but it's a very spiritual experience, being able to look at who you are, what your meaning of life is, what your goals are, what this is all about, and it's an incredible journey.
What is your diagnosis?
I've got a lymphoma, which is cancer of the lymphatic system, specifically around my stomach area, and I also have AIDS. I've been very lucky. I've had a close group of friends who, none of whom have rejected me or made me feel like a leper or anything. So I suppose I've been luckier than a lot of people.
Should you feel like a leper?
No, well, of course not. I mean, in fact, I'm more in danger of catching anything they happen to be bringing around with them than they do from catching AIDS with me, especially with just normal social contact.
Are you going to pull through?
Yes. Yes, I don't see why not.
John here, are you lovers?
Yes.
Yes.
How long have you been together?
4 years.
Does this come as a shock to you?
Yes. Fortunately, Russell's very strong. He's got a terrific attitude towards it. So that makes it very easy for us to have a fairly good attitude as well, which means it's not hard to assist Russell.
How has it affected your relationship?
I think we've become a little bit closer. We've had only 4 years to build our friendship up, so...
Hasn't done anything for her sex life, though.
As a couple, how do you explain Russ contracting an AIDS-type condition?
Russell's not monogamous.
Do you have any regrets about that?
No. I regret being tall more than I do being monogamous. Or polygamous, sorry.
Do you become depressed?
On occasion. Well, I mean, anyone would. Anyone who had a serious car accident would become depressed on occasion.
Are you afraid?
Yes and no. I'm not scared, but I'm not naive about the possibility of outcomes.
When that time comes and he has to face the finality of the situation, I don't want him to have any fear whatsoever.
Will you still be there?
You betcha.
I can't imagine what it'd be like to have to face this by yourself. I think that would be very drastic and very cruel. Very cruel. I've been so lucky in many ways. I mean, you don't find people with AIDS and cancer claiming to be lucky, but if AIDS and cancer was all I had, then I would be very unlucky indeed. I mean, you really do need all the support you can get. and to be treated like a normal person who has a disease, whether that, I mean, hepatitis is an easy disease to catch, and there are lots of far more life-threatening diseases, and there are worse forms of cancer than lymphoma, so I don't feel too bad. I don't feel lucky, but I don't feel too bad about it.
It took a deal of courage for some of those people to cooperate in our program tonight. Our thanks to them all. Four Corners will be back next Tuesday night. See you then. Good night.